Earlier this year, following the PIP implant scandal, the government-backed Keogh report called for tougher controls on increasingly popular cosmetic surgery procedures.
So what should you be checking if you're considering cosmetic surgery to make sure that it's safe for you? Well, joining us now, we've got Stephen Handisides. Now, Stephen is a journalist. He's researched and written about the cosmetic industry for over 11 years now, is it, Stephen?
That's correct, yes.
It is, you know, there's a lot of cosmetic surgery out there now. Every magazine you pick up, endless adverts, lots of adverts on the television. So it is a bit of a mindful. People say, do your research, you know, find out about it, when there's so much.
There is. I mean, the review that in April that was released by an independent committee and also headed up by the NHS Medical Director, Sir Bruce Keogh. The idea behind the findings of the review was to tighten up the controls around the cosmetic surgery industry.
It concluded by saying it's a crisis waiting to happen.
Yeah, so the whole review was basically around sort of tightening up the control and protecting consumers that are actually considering these types of treatments.
And have you found that in your research, that there are a lot of cowboys out there?
Yeah, there are a lot of sort of unsafe practices out there, but a lot of it comes down to not being adequately trained in certain procedures. So this review will hopefully go through, and then we'll have new legislation.
You've got we'll come on to our three procedures we've got here: non-cosmetic, you know, sort of non-invasive procedures, surgical, in a moment. But you've got some top tips, so just talk us quickly through those.
Yes, so my top tips: if you are considering a cosmetic treatment, you know, do your research on the different treatment options, the different providers that are out there. There's a whole plethora of information online. Look at, make sure you have a thorough consultation with a cosmetic practitioner that specialises in that area that you want to have treated.
But is there a list? I mean, how would I know? How would I know somebody is a qualified practitioner?
Yeah, it's when you go in and you actually have a consultation, you know, don't be afraid to ask them about their qualifications. Do they belong to some of the main industry associations?
And can you ask to see certificates?
Of course you can, yeah. Yeah, it's very important that you have a good rapport between your cosmetic practitioner.
And would a GP refer you to somebody good if you started with your GP?
Yes, recommendations from friends and family, and obviously the GP also is a very good way to start.
And I suppose really you've got to think, don't go for the cheaper option, because cheap isn't always best.
Yeah, and that's why
something like this.
Exactly, and that's why it's important to even go and see a number of different cosmetic practitioners to get a balanced view.
Well, let's look at what we've got here. These extraordinary pictures. This is what I walked into this morning. This is Nicole. Hello, Nicole. How are you doing? You all right there? Lovely. And then we've got Sarge, who's here, who's talking about the Wonderlift. What is the Wonderlift? What does it do?
Wonderlift is a non-surgical, pain-free, non-invasive breast enhancement machine which also helps to lift and firm.
How does it lift and firm?
It has a three-step modality which works with vibration massage and vacuum suction, microcurrent therapy and low-level light therapy. So it's working on the pectoral muscles, it's increasing blood circulation, increasing the cellular energy, which is known as the adenosine triphosphate, and also working on the skin to help it rejuvenate.
Now, I have to say, that reminds me of when I was expressing milk when my son was a baby.
Well, no, I mean, expressing milk, that's a sort of slightly smaller affair than this, isn't it? I mean,
yes,
I've got to say, this is almost down in the country.
It's not for men.
What do you, what do you think of this?
I think it's a good treatment. I mean, you do need to, after the first treatment, people should see some type of results, but you need to follow up with 2 to 3 treatments within the first week, and then 2 or 3 treatments after that. So you do have to have the time out of work to be able to go to have these treatments.
So, Nicole, I've got to ask you, does that hurt?
No, it's quite comfortable.
What does it feel like?
Just feels like suction, really. It doesn't hurt or anything.
And why did you want this treatment?
Well, I'd been for consultations for surgery, but I was just a bit conscious about going under the knife, so...
So you thought this was the next best thing? How many treatments have you had?
I've had 3 treatments so far.
And what difference have you noticed?
Yeah, I've noticed a difference. Definitely look fuller. They feel a lot firmer.
Well, we've got a before and after. Here it is. And for our eyes, we have to say that we haven't spotted a major difference here, if I'm being honest. Can't see that that's after 20 minutes there. Should we be spotting some difference or a greater difference than you can see?
Yeah, as I say, like after the first treatment, it's a 30-minute treatment, but it's really important within that first week to have 2 or 3 treatents.
Consecutive treatments.
Yeah.
But do you have to keep having it done? So would then go back to the size that she was, and then in another 2 months you'd have to have the whole thing done again?
No, how it works is you would, we normally recommend a course, which is approximately 12 treatments, and then they would have a maintenance programme of 6 treatments that can be over a 12-month period or a 6-month period. Results should last up to 2 years.
Oh,
I think we should move on because we won't get these others in if we don't smarten up a little bit. Hello there.
Hello.
And this is Tapan, yes?
That's right.
Hello, Tapan. And Lorraine is here. What are you doing to Lorraine?
So Lorraine is having a treatment with the Exilis machine, which is a form of radiofrequency treatment. So just to give you a bit of background, radiofrequency is a form of electricity, and it's been used in medicine for over 70 years. And what we're really doing is we're using that radiofrequency to heat the tissue at variable levels. So we can focus it a little bit deeper to start breaking down some fat deposits, and we can use it more superficially to tighten the skin.
Doesn't work on cellulite?
It depends on the grade of cellulite. Cellulite obviously can be very mild to very severe. Where the cellulite is a problem more of loose skin, it certainly give you an improvement.
So this is supposed to melt the fat, and it comes out in your urine, is that right?
Correct, through the lymphatic system, isn't it?
Correct. I mean, what happens is when the fat cells break down, it releases the contents, and the contents are then disposed of metabolically by the body.
So, it's important to note that this is a medical treatment that needs to be done in a clinical environment in compared to the Wonderlift, which is a beauty treatment. Now, if you're looking at other treatments that are on the market, there's something called cool sculpting, which compared to the Exilis treatment, you need 4 treatments. Each treatment is between £300 to £500. The cool sculpting treatment would be around starting from £800, and another treatment which is called vasolipo starts at about 2,000.
Notice any difference?
Lorraine, what do you think?
Not yet, but I've only just started out on the treatment. There's no pain, and it just feels very warm.
Okay, all right, thank you very much. Next up, we've got Lenka, who's here. This is the placenta facial. In the news at the moment, I'm going to tuck myself round here. So is this a sheep's placenta?
So this is a sheep placenta that I'm just putting on my client's skin right now.
Yeah.
And we just gently rub it in, and that's going to go inside the dermis, so in the lower layer of her skin.
What's it supposed to do?
So it's going to help with redness, it's going to reproduce the cells that are already in her skin and just make them grow, and it's going to help with any inflammation, any pigmentation, and it's going to rejuvenate the skin, it just brightens it up.
All the claims sound amazing, don't they? There've been a lot of talk about this because allegedly Victoria Beckham has this treatment, maybe Simon Cowell, so a lot of celebrity talk around this. It sounds amazing. And we all know there are a lot of vitamins and minerals in the placenta. Do you think this works?
Correct. Yeah, I think there's a lot of products out there, and there's a lot of treatments out there which do a similar thing. But again, it's always quite a little bit quirky, and I think people really like to try something different.
It's definitely taste as well, isn't it? I mean, obviously not taste as in taste, but it's your own personal taste as to whether or not you would want parts of a sheep's placenta put on your face.
Exactly, and it's funny enough, the sheep placenta actually comes from New Zealand, and it is very rich in proteins and minerals.
Well, you're saying that New Zealand sheep are better than British sheep?
I'm not saying that at all on national television.
Disagree with him.
What did you think when they said we're going to put sheep's placenta on your face?
I didn't mind because it's also got a bit of gold in it as well, so I'd rather that bit. But no, there's no smell. It's very comfortable, relaxing, so I'd definitely pay to go and get it done.
You would?
Okay. All right, well, we'll leave it there. Yeah. Thank you very much indeed. Thank you, Lenka.
Thank you, Lenka.
If you would like to know more about these treatments, or if you're considering cosmetic surgery, then head to our website for help and advice.
Now, coming up, what camera am I on? There you are. Hello, coming up. She's one of the biggest campaigners for marriage, although ironically she's never actually been married herself. Is it too late for Anne Widdecombe to find love? I'm sure she doesn't mind. She's a national treasure anyway. We'll find her after the break.